It was a massive task when we sort of sat down to work out how we were going to safely return to sport. And the big advantage of the Simplified Checklist was it was able to break this task down into manageable, small, well-described areas. And then each of these areas we were able to go through, see if we've done it well, see if we've done it safely, see if we've done it to the best of our ability, and then we're able to move on to the next one. The other big advantage of the Simplified Checklist was we were very easily able to send out tasks or delegate tasks to different members of the committee at Sutherland. So I was able to give well-organised, well-described areas of safety coordination to different members in our committee, and they were able to then break down what was a very large task into smaller, manageable pieces. It was also a very good way of making sure that we'd thought of everything, to making sure that we'd covered all the areas, and making sure that there wasn't anything that was missed, anything that wasn't looked at, or anything that potentially was unsafe for our members and for those returning to sport. Sutherland used the Simplified Checklist as our framework to begin our safe return to sport. We were able to look at the areas that we needed to cover, and then by knowledge of our venue and our club, we were able to apply them to those people. Obviously, no one would be able to write a plan that would be applicable to everybody. You needed some local knowledge of your particular club, of your particular venue, and of your particular playing people. So we will use the Simplified Checklist and go step by step through each area and looking at what was the best way we could do it. The classic one was how we could safely enter and exit the field without different groups running into each other, without having potential crossover, and we were able to work out a nice circular pattern for entry and exit, which passed through checkpoints for attendance record, hand hygiene stations. It kept different groups of players separated, and then we were able to leave safely, return to our car, and that would minimise crossover of people. The other way we were able to use the checklist was to look through all the areas of the club that could be safely used, and other areas that at this stage, due to size, ventilation, inadequate cleaning, or possible cross-contamination of people, that were best at this stage to close off and not make available for use. And this was another way we were able to use the safety checklifts to make return to sport at Sutherland Hockey Club safe. By using the Simplified Checklist, it was very easy for me as a COVID safety officer to be able to delegate tasks to different members of the committee. It was a big job to get the members of Sutherland Hockey Club back onto the field safely. At first it looked like a massive task, but once we found that the AIS and Hockey New South Wales had made a framework, a roadmap basically for how we were going to return to sport safely, it was very simple to be able to go through those points one by one, consider them, apply them to our club and our members, and then for things that needed to be done, it was easy to be able to delegate because they were discrete tasks that were able to be done. And I was very lucky because I had a very active, enthusiastic committee, and each member was able to take on a small, manageable role, and then together, by overseeing all those small tasks, by having one person overseeing that they were done and done safely, we were able to return to hockey in a safe and timely manner. I'm an anaesthetist that works at the local hospital. During the start of the COVID-19 pandemic, we were doing a lot of training and preparation for being overwhelmed with incredibly sick patients with COVID-19. And obviously at that stage it was very important that we limit spread of COVID-19 throughout the community, and that was the stage that we were at lockdown. As the situation, due to the fantastic response by the Australian public, as the situation improved, and we were able to ease restrictions, it was also incredibly important that members of the community be able to get back to community sport. When you're not able to do it for a while, you realise how important it is to your mental well-being, to your physical well-being, and to social engagements with good friends. I'm also a parent of 2 teenage children, and them not having community sport to be able to meet with their friends and to get active and get outdoors was a very trying time. So as the situation with the pandemic of COVID-19 improved, it was very important that Australian citizens were able to get back to community sport so that they were able to have those social connections and those mental health benefits of being able to get outside, exercise with friends, and connect on a community level. As a doctor, I also knew that it was very important that we were able to do this safely, even though coronavirus was being well controlled in the community. Didn't mean that it was completely gone away, and it didn't mean that it couldn't reappear at any stage. And we need to protect not only our hockey playing community, we also need to protect the families, the grandparents, and the vulnerable people in our society. So it was very important they were able to do this in a safe manner. If we were to have to wait until the entire pandemic was over, I think that a lot of Australians would have suffered. They would have suffered from lack of social connections, they would have suffered from lack of community involvement and lack of physical exercise. And so it was wonderful to be able to have the framework Return to Sport in place so that each individual community group was able to enact those plans and get their little section of the community back to sport safely.